Wonderful. Well, good morning, everyone. I am Amy Gilbert. I'm based in Abu Dhabi, and today I am going to be talking about mindful prenatal connection and preparation. Now, before we start, in the bottom of your toolbox, you should see a little globe. And so if you would like to listen to this presentation in Arabic, please click on there and we have a translator who will be running that for you this morning. So I'll give you a couple of seconds just to click on that globe if you'd like to listen to this presentation in Arabic. And then if you did have any questions, because hopefully you will do if something comes up through the presentation, please just put those into the Q&A box and I will address those at the end of the presentation as opposed to during. So if there are things that come up that maybe you'd like a bit more information about or you're not quite sure about, please just pop those questions into that Q&A box. Again, you'll find that in your toolbox at the bottom of the screen and I will address those at the end. So hopefully people are on and I can get started. So first of all, just a little bit about me. I am from the UK. However, I have been in the UAE, in Abu Dhabi, for over 20 years now. I grew up here, so Abu Dhabi very much is home for me. But as a physio, I've been here for 12 years. So I trained in the UK, well, I left here when I was 16, went back to the UK, continued my education and trained in the UK, worked in the NHS. And then I came back to the UAE to continue my physio career. I am actually the owner and head physio of a clinic on Ream Island called Perfect Balance Rehabilitation Centre. We opened in December 2017 and we have a great team of physiotherapists, both women's health, sports injury and paediatric physios, plus speech and language therapists for children and also a dietitian for children and adults. And we're a team that works wonderfully together, both holistically and with the patient's best interests at heart. Now, my speciality is women's health, and I'm a member of the Pelvis and Obstetric and Gynecological Physiotherapy Society in the UK, which keeps me up to date on the most current practice. And hopefully today I'm going to give you an idea of remaining mindful whilst pregnant and getting you through that kind of prenatal experience and into that postpartum period. And I've been talking about women's health for over 5 years now. And since having my first child, baby Lily, 2 months ago, I now feel much better prepared to be talking about this kind of more of a mindfulness approach as opposed to just the physical, which I am very passionate about also. So today, it doesn't matter whether you're pregnant with your first child, your second child, your fifth child, for example. What I'm going to be talking about today can be applied to the first and also even up to the fifth, even if you've not thought about this in the first couple of pregnancies that you may or may not have had. I'm going to be talking a little bit about fears, but to pregnancy and delivery and becoming a mother and kind of my experience of that and how I got through that. But more talking about how my experience in gaining knowledge to prepare helped me ease my fears. So rather than dwelling on fears, I'm going to be talking more about easing and preparing. And then trying to get that balance of preparing, because, and again, through my experience of how over-preparing can actually increase expectations and drive fear. So, which then comes on to managing expectations and then preparing the physical body, which is where my expertise is. So pregnancy. Now, pregnancy means very different things to different people, and I found it was very influenced by the people who are around me and what experiences they were going through. So I found that because I talk about pregnancy all day long and people's experience, that can actually drive fear. It can drive fear by creating a certain expectation, by stories from others, and also by the unknown. So that pregnancy also, means different things to different people through what we read and research, where we get our information from. So we're very fortunate nowadays that information is literally at our fingertips on our telephones. There's been many a night where, whilst I was pregnant, I'd experienced a strange symptom. I'd gone to Google and the answer, or maybe not the answer, was right there, which from some part is great, but on the other side, it can really drive fear and create unnecessary emotions that maybe aren't necessary. And I found that through getting that balance of friends and family members' experience, which is really important, what we read and research, and how I found what I was trying to get was how to own how our own pregnancy progresses and how we get our own experience. So that is hopefully what you'll get out of today. Now, the other side of knowledge and what we get when we're going through something the unknown, is we do seek doctor's advice. And I did exactly what I said I wasn't going to do. I doctor shopped. So I said I was going to go to one doctor originally, and that was all I was going to do. And but I did exactly the opposite, and I saw 5 doctors, all who gave me different advice. But what I was trying to do, I was trying to find somebody who I connected with, who understood what was important to me and my husband, and in the end we found that, which was why I did what I said I wasn't going to do. But equally, it was just as important for me to be able to feel that I could own my own pregnancy, and I could have somebody that supported that. Now, this is something that I found really, really interesting, that thinking will not overcome fear, action will. Now, when I felt fear, whether that was to do with the delivery, whether that was to do with finishing my pregnancy, or even just that fear of adjusting from being somebody who was a business owner, someone who was a physio, a wife, a friend, and transitioning into being, to becoming a mother, I'd always come back to a particular thought, which really helped ground me, I think, through the pregnancy. And that was that we're all put on this earth as women to birth babies. And that really helped me come back and ease my mind that it doesn't matter how much I read or how much I try and prepare in terms of gaining knowledge from different people and reading, articles or whatever it might be, that actually our bodies are built to do it, and to trust your body, which that helped me remain mindful and helped me connect a little bit more to that prenatal experience. Now, I don't know how many of you know how many babies are born each day, but this also helped ease my mind when maybe I became fearful of that unknown. And there are 385,000 babies born each day, across the world, which is just phenomenal. Which means 385,000 women each day are delivering. It means that each day 385,000 new mothers are finding out that they are pregnant and going through that same process, that fear of the unknown, and that really helped ease my mind at times again when that fear of the unknown might be there. So how I then took my knowledge and my experience, I decided to prepare. I decided to read everything, as I very much, enjoy science with the field that I'm in. And I will explain how that influenced me over that period of those 40, or in my case, 38 weeks. So preparing through gaining knowledge. Now, like I said, getting information from friends and family right at the beginning, and friends of friends, was so valuable at the beginning. And I, got information from all sorts of books, the internet, courses. I did all the courses out there. We run many courses at the centre, and I wanted to be part of all of them. So I did prenatal workshops, I did prenatal yoga, prenatal Pilates, and I did hypnobirthing. And in the end, from kind of 34 weeks onwards, so for my last kind of 6 weeks of my pregnancy, or actually 4 weeks, I found that all of that preparation actually became quite overwhelming. And the reason why was because it created all these different expectations and almost put too much pressure on, because I read about all these plans of keeping babies in all these sorts of routines and how my delivery should go based on other people's expectations, and because of that, I almost felt that there was this huge expectation on my shoulders that my pregnancy must go this certain way, or my delivery must go this certain way. And so in the end, from 34 weeks onwards, I decided, actually, I'm going to stop reading. I'm going to stop feeling that pressure from friends and family and from all those courses. And I decided what I'm going to focus on is my body, because my body is what's going to birth this baby. And by preparing my body for the delivery, and then also that postpartum experience, or that postpartum period, that then helped ease my mind, because I found that I could focus on something that wasn't making me or put myself under pressure, but I still felt like I was preparing and connecting with my body before the baby arrived. So, like I said, I decided to focus on my physical body, and I'll go through in the next few slides on what that then looked for me. Now, you may or may not have done any of the courses, and hypnobirthing for me was so valuable with regards to keeping a positive mindset and helping me prepare, and my husband prepare actually, for the birth. What I actually didn't do, which was part of hypnobirthing, which I ended up not having a birth plan, and what I instead decided to do was have ideas of what was important to me, and I then communicated that with my obstetrician and before I delivered, and said, these things are what are really important to me, and these are things I feel I can control, but ultimately what happens on the day and what's important is that both myself and the baby are safe. So rather than me having really clear, rigid plans of this is what has to happen, I started to feel some anxiety surrounding that, and felt that actually I was putting more pressure on myself that maybe wasn't actually needed. So, sorry. Can you still see my screen?
No, we can't.
Okay, 1 second. I don't know why that just happened. Let me just go back on. Is it back?
Correct.
Okay, apologies about that.
All good.
Okay, super. Then we go on to, there we go. And you can still see that, I hope. It says it's still showing, yes. So, remaining mindful. Now, what I invite you to do in terms of getting through, whether you're, like I said, pregnant with your first child, your second, your fifth, is coming back to the question of what's important to you. And I really did ask myself that quite a lot through my pregnancy, especially towards from kind of 32 weeks onwards, of really understanding what's important, because what's important to you is very different to what is important to the next person who walks through the door with the obstetrician, or is very different to the next friend that you might speak to who has gone through multiple pregnancies and deliveries. And I always came back to the thought that, of trusting my body, of trusting that my body knows what it should do, which can be quite scary at times if you don't feel as connected to your body as somebody else. But understanding and remembering that our bodies are built to do this. Our bodies are built to and designed to bring children into the world. So that is what I very much came back to on a regular basis. Now, I also tried to remain mindful by remaining open-minded when receiving advice. So what can happen, and what I found, yes, part of my medical field and my medical background, I talk about people's pregnancies and their experiences all day long. So I do hear and have heard and end up not necessarily being shocked by many stories. But what you do find is that people often like to share their stories of what their pregnancy and what their delivery was like. And more often than not, it does come down to, to sometimes negative stories, which can really influence how how fear might be driven from that. So I when I was speaking to people outside, obviously from a professional point of view, but when I was speaking to friends and family, if people were telling me their stories, I would always listen, but I would always remain open-minded and understand that all of our bodies are different, and therefore all of our experiences are different. Now, knowledge, like I said, knowledge is known to give you power, and I please don't take away from this that don't now start reading books, because it is so important to gain the knowledge that's important to you, and it does give you power, because it helps you get an idea of maybe what to expect, what not to expect, but also give you that idea of options that are out there. But it can increase expectation that you might put on yourself. And I very much felt that, even though I, very much talk about pregnancies and deliveries all day long, I read all of those books that were on that previous slide from front cover to back cover. My husband frequently commented on the fact that my bedside table ended up looking like a library. And I would go from one book to another, and one book would say X and another one would say Y. And so coming back to that, remaining open-minded when receiving advice, and that advice might be from books, that do understand that a lot of that is written from people's experience, and everybody's experience is different. So ensuring that you remain realistic, and for example, originally I'd thought that I wanted to have this, a water birth without any intervention, and unfortunately that, me remaining realistic meant, I realized very quickly that I wouldn't be able to have that, because there weren't any water birth hospitals available that I wanted to deliver in. So, remaining realistic and gaining that information from an early point, early standpoint in your pregnancy, really, helps to guide those expectations later on. Now, I mentioned on the previous slide about hypnobirthing, which I am so thankful that I did, and it encourages to write things down. But what I took away, through the end of my pregnancy, and actually when I experienced my own delivery, was that do write things down and have ideas of what's important to you. But maybe they're not necessarily need to be written in concrete. And if anything doesn't go to that plan, don't be disappointed. Because at the end of the day, what is important is that we are all safe and healthy. And if we try to stick to something that we've put such a huge expectation on, that sets us up, I guess, for not meeting those expectations, which can be really difficult to deal with then in a postpartum period. So remaining mindful of what's important to you, write those things down of what is important to you, and write those down with your husband or birthing partner, but understand that maybe they might not be in concrete. I had written a birthing plan when I was about 28 weeks pregnant, and if I had left that and really needed that in concrete, then yes, who knows what would have been the outcome. So definitely having an idea of what's important, but not necessarily thinking that has to be stuck to, really helped me remain mindful during those last couple of weeks. So, as I said in my previous slides, how I really got through the end, or a lot of my pregnancy, and then towards the end of my pregnancy, was coming back to the part that my physical body was, growing my baby, and I needed that to be strong whilst I was pregnant to get me through the rest of the pregnancy, but also strong for the delivery. So what I invite you to take from these next slides is not that everybody has to do everything, and remembering that that starting physical exercise later on in pregnancy, if you haven't been doing any exercise already, it's really important to get the advice of your medical practitioner before you start anything. If you have been someone who's always exercised when you haven't been pregnant, and you've just found out you're pregnant, then continuing physical exercise, as long as there's no medical reason to stop you from doing so, is so important. Because from a physical point of view, it maintains that strength of the body to get you through the pregnancy when your body is going to be changing, and helps you to remain strong for your delivery. And then also not forgetting that postpartum period where your body's got to be strong for carrying, feeding, changing a baby multiple times a day. So from a physical point of view, that's really important. But then from a mental point of view, of the endorphins that get released whilst exercising, and the fact that it can, lower anxiety levels and lower fear levels by knowing that you've got some form of control, can be so vital. So what's important is variety and doing something that your physical body enjoys. So if you have always been somebody who, really doesn't enjoy Pilates and really doesn't enjoy yoga, but your best friend swears by it and says you've got to do prenatal Pilates, you've got to do prenatal yoga, but actually your body doesn't enjoy it, then don't worry, do something different. I always invite people to exercise in a way that their body enjoys, because otherwise you're not going to get all of that, the mental benefits that you get from exercise if you're doing something that is more of a chore. So strength training, and that could be Pilates, that could be weight training, that could be yoga, pelvic floor exercises, which I will go on to, which I'm afraid and not necessarily something that you should skip. Your pelvic floor exercises should be a constant through pregnancy and in the postpartum period, and I'll talk about why. And then postural exercises, which often people forget. In the prenatal period, our bodies are changing shape. We're increasing our center of gravity anteriorly or to the front because of a growing abdomen, and so it's really important to maintain strong postural muscles. Yes, to get you through your pregnancy, but definitely for that postpartum period when you're then carrying a baby and feeding a baby, and in that kind of anterior rotated position. And breathing exercises are 100% vital. We can lose ourselves, whether that be in exercise, whether that be in fear, whether that be in an anxiety-driven state, that we can lose our sense of breath. And so taking a moment to connect to your breath and using that as a way of decreasing fear and a focus point can be so vital to periods during your pregnancy when you might feel a little bit lost. And it gives you something internally that you can bring yourself to and bring your attention to fairly easily. I found that connecting with my breath helped me get through a huge part of my delivery process, which I definitely learned through yoga and also through the hypnobirthing. So, like I said, variety of movement is really important, whether it's for your prenatal or postpartum experience. But I think what's even more important is that doing something that your body loves. Again, I talk to women all day long about exercise and what I think is important to them. But the question I always ask is, what do you enjoy doing? Because there's not much point in trying to force yourself to do something you don't like. If you've never been a swimmer, but suddenly somebody says, "Oh, all you need to do is swim and you'll be okay," your body might thank you, but your mind might not. So make sure that you're doing a variety of exercise, but doing something that you enjoy. So pelvic floor. Now, I'm not going to stay on these slides too long, but what is really important, and I found has helped so many women that I treat and see, is knowing what the pelvic floor is. Now, a lot of people I often say to them before I've even described or shown them is, what do you think the pelvic floor is, or what do you think it does, or what do you think it looks like? And often people think of it like that picture that you can see on the right side where it's just this thin band. And actually, it's this incredible makeup of multiple muscles, as you can see in that picture on the left-hand side, and it sits as a support system underneath the pelvis. Now, it can be described as a sling, it can be described as a hammock, but what it does, it's this incredible muscle that supports all of our pelvic organs, as you can see in those bottom pictures. It supports our bladder, which sits at the front, our uterus, or some people call it their womb, and then our bowels. If the pelvic floor is not working effectively, we can then experience some really, not particularly nice symptoms. However, the good news is that by doing some simple exercises of the pelvic floor whilst you're pregnant and in the postpartum period can be a really easy way of maintaining the strength and then the function of the pelvic floor, which can significantly reduce your any risk of symptoms. So, the function of the pelvic floor, like I said, it supports the bladder, the bowel, the uterus. It acts as a sling of support. And it does work with our breath. And what's important is that when you're doing the pelvic floor exercises, is that you're not thinking about holding your breath. We want to be able to engage the pelvic floor whilst breathing. Now, pelvic floor exercises, a lot of people don't necessarily start thinking about them until they're pregnant, because their friend or family member, or maybe their doctor has, or maybe their women's health physio has brought it to their attention. And I encourage you, whether you are 2 weeks pregnant, whether you're 38 weeks pregnant, to bring some attention to the pelvic floor. Now, pelvic floor exercises should change through pregnancy. So in the first 34 weeks, we talk about elevation and up training. And then from 34 weeks onwards, we talk about down training of the pelvic floor. Now, I am aware that I have a time constraint here today. And so if I go on to talk about just pelvic floor exercise, I could be here, well, we'd all be here until about 6 p.m. this evening. So what I invite you to do, you're very welcome to have my email at the end. And if you do have any questions about the differences in up training and down training and whatnot, then by all means, drop me an email and I can give you some more information about that. But what is very important about the pelvic floor is that we're able to connect to it. You're able to feel a contraction, and we're able to get that elevation movement, that movement up of the pelvic floor, because that means you're training it to support the pelvic organs, and then you relax to let it go. So what we don't want to do is we don't want to be holding our breath when doing pelvic floor exercises. As you can see on the picture on the right-hand side, when we hold our breath, we actually increase our intra-abdominal pressure. And that then actually puts a strain, it puts a bearing down on the pelvic floor, which actually does the opposite of what we're trying to do. So when you are doing your pelvic floor exercises, please make sure that you are still breathing. Hopefully that makes sense. So why we talk so much about pelvic floor is that the symptoms that, can be as a result if the pelvic floor isn't working properly, are very significant, and they really impact on people's quality of life, whether that be during pregnancy or after. And the really common things when a pelvic floor is not doing its job properly, which is called pelvic floor dysfunction, the pelvic floor stops, being able to do its supportive role, and doesn't allow the pelvic organs to be able to function normally. That can lead to low back pain, incontinence, which whether that be urine or feces, and pelvic pain. So if you are experiencing any of those three things whilst you are pregnant, it's really important to seek advice from your medical practitioner, who would then refer you on to a women's health physio, because checking the function of the pelvic floor can be is vital when assessing those three things. So urinary incontinence, like I said, this is a really common symptom of why somebody would come and see a women's health physio. And that might be whilst they're pregnant, it might be after. And what that means is leaking of urine. Now that can happen on a variety, a huge variation, or a very varied scale. It could just be when someone coughs or sneezes. It could be when somebody's on a trampoline. It could even be every time somebody stands up from a chair. So through doing pelvic floor exercises and maintaining a strong pelvic floor whilst you're pregnant and preparing the body as much as you can really help reduce the risk of getting any urinary incontinence. However, if you are suffering from those symptoms, please talk about them with your medical practitioner. Urinary incontinence is something that so many women suffer with and put up with, and because it's so common, that almost normalizes those symptoms. And just because all your friends are suffering from it or all your family members are suffering from it doesn't mean that you have to as well, or that it's normal. It's common, but it's not normal. So through doing pelvic floor exercises and making sure that those muscles stay strong could be a really great way of helping reduce the risk and also reduce symptoms. So how to correctly engage the pelvic floor. Now, through my experience, everybody responds to different cueing. So what's very important is that you feel it and that you know what the pelvic floor is doing. If I go back to this slide, try and picture the muscle. And I find that really helps people, that, picturing the muscle drawing in and lifting up. And that's what you want it to be doing. So if you are sitting, thinking about the muscles drawing in and lifting, hopefully you're all thinking about that now. And thinking about it from a visual and a physical point of view can really help connect, because it's very easy if I tell you, okay, connect your bicep. Well, if I, tighten my bicep, my arm moves, and you've had this visual representation of what's happening. But from a pelvic floor point of view, you can't see what's happening. And so having that visualization of the muscle can really help to connect. So like I said, the importance of breathing. Make sure you are breathing when you're doing the pelvic floor. Ensure you're not overactivating your abdominal muscles. And make sure that, I sometimes find this cue helps, make sure you're not done until you fasten the button. So thinking about the pelvic floor of zipping up and making sure you come all the way around to the front can be a really great way of helping engage. So you're drawing in and you're zipping up to the front can be another great way of helping connect and feel that pelvic floor contraction. So when should we be engaged in the pelvic floor? Definitely not always. And you may never have thought about your pelvic floor before, and you may not have any pelvic floor symptoms, which is exactly how it should be. The majority of the pelvic floor work should actually happen subconsciously, a little bit like an iceberg. You have this small conscious control, this iceberg that sits on the top of the water, but actually the majority of the work happens underneath the water. It happens subconsciously, and that ultimately is what we're aiming for. People very often say, how long do I need to train my pelvic floor for? And the answer to that question is different for everybody depending on their symptoms. But once you've built up that strength and that ability of the pelvic floor, it should work subconsciously for you, which is what it should do in the majority of people. However, sometimes it just does need some conscious support to help it get it on its way, help strengthen after it's gone under an increased strain and load during pregnancy and delivery. And so it needs that extra conscious control, which then ultimately drives and feeds into that subconscious control long term. So a couple more things on the pelvic floor before I finish. So common mistakes when activating the pelvic floor is holding the breath. So people often will say, yeah, I'm doing my pelvic floor, and now I'm not, which, like I said in that previous slide, that increases intra-abdominal pressure, which puts an increased load on the pelvic floor, which actually doesn't help train and get it ultimately stronger. Overactivating the abdominals. So when you are doing that pelvic floor contraction, try not to think about tightening the tummy muscles too much. We're trying to just think about that muscles internally and that movement up and that elevation. And then again, not thinking too much about the co-contraction of other muscles. So another one that people like to do is squeeze their bottom muscles and their leg muscles when they're doing their pelvic floor, trying to avoid too much of that co-contraction and just thinking about that internal elevation of the pelvic floor. And then through the only real way of understanding whether someone is bearing down or elevating truly is really through seeing a women's health physio and having an internal exam to check to make sure that you are elevating the muscle and not bearing down. So like I said, we want the pelvic floor to be drawing in and elevating and not bearing down. So that's why having that kind of feeling, sometimes doing it with your hands at the same time can help you avoiding that mistake of pushing or bearing down on the pelvic floor. So we're wanting that pelvic floor to work actively, we're wanting it to be responsive, and we're wanting it to be supportive. So, like I said, hopefully, I don't sound like I've been put on repeat, but we really want that elevation of the pelvic floor. That is what is key to a good functioning pelvic floor that is supportive and that is strong. So we're wanting that elevation movement. So you're very welcome to take a picture of this slide if you would like to, because pelvic floor exercise practice is vital. Now, this 3 to 4 times daily of just doing 10 reps really is fairly simple, but what we need to do is try and remember. So I obviously remember because I talk about the pelvic floor all the time, but for somebody who hasn't thought about the pelvic floor before, it can be really challenging to remember. So even just aiming for 10 reps a day is a good way to start, and sometimes combining it with another activity, for example, linking it to brushing your teeth or brushing your hair or sitting in your car at the traffic lights, can be a really great way of remembering, attaching it to another activity, because guaranteed if you just think, yeah, I'll do it later or I'll remember later, guaranteed a week will go past and you may not have done them. So up until 34 weeks of pregnancy, doing these exercises 3 to 4 times daily, around 10 reps a day, and thinking about that elevation is a great way of keeping the pelvic floor strong, preparing for your delivery and aiding that postpartum experience. And then I often give women the day of delivery off, but then as long as your doctor hasn't advised you to do otherwise, you can then do those pelvic floor exercises from day 1 after your delivery. And again, thinking about that elevation. Now, from 34 weeks onwards, what I teach people to do is down training of the pelvic floor, and it's more of a letting go and a relaxation of the pelvic floor, which I'm not going to go into too much detail today because it's a little bit more complicated. But like I said, if you wanted some more information about that, please do reach out. So that mindful prenatal experience. Today, I've used obviously the knowledge of my background of being a women's health physio, but also my experience of becoming a mother, of going through it and experiencing, what I teach people, but also having that understanding that there is a lot of information out there, and coming back to that of understanding what's important to you will help you remain mindful, will help you remain present, and will ultimately drive an experience that ends up, being a positive one. So I'll just leave you with, with this thought today, that do not lose yourself in the past. Do not lose yourself in the future. Do not get caught in your anger, your worries, or your fears. Come back to the present moment and touch life deeply. This is mindfulness. So come back to remembering what's important to you. Come back to how you feel, and remain as prepared as you possibly can, but enjoy it, because it really is a wonderful experience. So I hope you found that presentation today, or that webinar, informative and enjoyable. But please do, I know pelvic floor and women's health can be a challenging topic sometimes. So if you do have any questions that maybe you don't feel comfortable asking on here today, by all means reach out via email. What I found through my women's health journey, both professionally and personally, that it's really important to share, it's really important to ask, and remember that you are not alone. There are 350,000 women a day delivering babies, and so I'm sure at least one of them, if not many more, are going through and having those similar questions. So by all means remember that, and yes, and thank you very much for today for listening. So I'm just going to come to the Q&A box. Let me just stop. No. So I'm just trying to open my Q&A box. There we go. Hi Nancy. So you asked how to cure these horrible headaches without taking Panadol. So headaches can come from a variety of reasons. I'm obviously not a doctor, and so I can't provide necessarily medical advice on those headaches, but what because they can be for a variety of reasons. A lot of people's headaches arise because of hormonal reasons, and depending on where you are in your pregnancy, there may be a different reason of why you're getting those. Now, I found I suffered with headaches in my first trimester, and making sure I was really well hydrated, especially now with us being in the depths of summer, making sure that you're well hydrated. If you're working at a screen for long periods of times, because our body has an increased level of relaxin hormone in our body, our ligaments aren't as necessarily supportive as they were, and so we can develop tension headaches because our muscles are having to work in overdrive to combat that, to combat the relaxin. So if you are working at a desk and a computer, taking regular breaks, working on postural exercises to maintain the strength of those postural muscles, so if it is a tension headache, those muscles aren't having to work as hard because they are stronger. I use trigger point balls very frequently in my practice, and so I would use a trigger point ball into the base of my skull. A lot of my headaches developed from tension through here, from looking down and treating people. So using trigger point balls and stretching and activating those postural muscles was a really great way of me reducing my headaches. But they did ease. Mine were there in my first trimester for the whole of my first trimester, a little bit into my second, but then they did ease. But if they are relentless and they do remain, then talking to your obstetrician or doctor about those is important. Let me see if I can come back to. I'm just going to. I can't actually see my I'm coming back to my Q&A box. So I don't see that there are any other questions, but like I said, I'm more than happy for you to have my to have my email, and if you did have any questions that you'd like to ask after them, please do reach out. Pelvic Floor is and talking about the pelvic floor was my first baby, so I feel very passionate about making sure that women understand about their pelvic floor and helping women get through some pregnancy and also that postpartum period. So if there aren't any other questions, then thank you very much for being part of this today, and I hope it was useful.